Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Prenatal testing. Introduction. Whether you are pregnant or planning to get pregnant, you want to give your baby a healthy start. To do this, you will need to have regular visits with your healthcare provider throughout your pregnancy. Prenatal testing provides information about your baby's health before he or she is born. During pregnancy, some routine tests are done to check your health as well. This program explains prenatal testing. It also discusses pregnancy and the types of prenatal tests that are done during each trimester. Pregnancy. This section reviews common terms and concepts related to pregnancy. The female reproductive organs include the ovaries, the fallopian tubes, the uterus, the cervix, the vagina. When a woman gets pregnant, the fetus stays in the uterus until delivery. The uterus is able to expand a lot. The lowest part of the uterus is called the cervix. It opens into the vagina. During pregnancy, the baby is in a special fluid called amniotic fluid. The baby and amniotic fluid are in a bag called the amniotic sac inside the uterus. The baby gets nutrition from the placenta. The placenta is an organ located between the amniotic sac and the uterus that grows with the baby during pregnancy. The mother's blood delivers oxygen and nutrients to the baby's blood through the placenta. The mother's blood also removes waste from the baby's blood through the placenta. The baby's blood travels to the placenta through the umbilical cord. The mother's blood does not go into the baby's body. Prenatal care and prenatal testing. Prenatal care can help keep you and your baby healthy. Prenatal care is the care a woman gets during pregnancy. Prenatal care includes health care, along with education and counseling about how to handle a pregnancy. Your healthcare provider will schedule you for many checkups over the course of your pregnancy. Pregnancy lasts about 40 weeks. The first day of your most recent normal period is the first day of pregnancy. The weeks are divided into 3 trimesters. The first trimester is the first 12 weeks of pregnancy. The second trimester is week 13 to week 28. The third trimester is week 29 to week 40. Prenatal tests are a part of prenatal care. These tests can help find health problems that could endanger both you and your unborn child, but these tests do have limitations. As an expectant parent, it is important to educate yourself about prenatal tests. You should think about what you will do if a health problem is found in either you or your baby. Prenatal tests can identify the mother's health problems that might affect the baby, the baby's age, sex, size, or position in the womb, the chance of some genetic problems in the baby, some abnormalities in the fetus, including certain heart problems. Certain prenatal tests are considered routine. This means that almost all pregnant women who receive prenatal care get them. Other tests are recommended only for certain women, especially those with high-risk pregnancies. This may include women who are age 35 or older, are adolescents, are carrying more than one baby, have had a premature baby or a baby with a birth defect, have certain health conditions.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
First trimester prenatal testing. First trimester screening can provide valuable information about your baby's health. Your healthcare provider might offer an ultrasound, blood tests, urine tests, other screening tests. An ultrasound exam can be done at any point during the pregnancy. An ultrasound uses sound waves to make a picture of your baby inside the womb. It can help your healthcare provider evaluate your baby's growth and development. At your first prenatal visit, blood tests may be done to check your blood type. This includes your Rh status. Rh refers to a protein found in red blood cells. If you have Rh negative blood, you might need a blood test. The test looks for Rh antibodies that can result from your blood mixing with the baby's. If untreated, these antibodies can attack your baby's blood cells by crossing the placenta. Blood tests can measure your hemoglobin level. Hemoglobin is a protein in red blood cells that contains iron. It helps the cells carry oxygen from your lungs to other parts of your body. Low hemoglobin is a sign of anemia. Anemia caused by pregnancy is common. Blood tests can be used to check your immunity to certain infections, such as rubella and chickenpox. You may be immune if you were vaccinated for these illnesses as a child. Rubella and chickenpox may cause birth defects or a miscarriage if you get one of these illnesses while pregnant. The mother's blood contains genetic material or DNA from the fetus. A sample of the mother's blood can show her risk of having a baby with Down syndrome or certain other genetic conditions. This is called prenatal cell-free DNA, cfDNA, testing. A pap smear can be used to check for sexually transmitted infections, or STIs. A pap smear also may be done to check for signs of cervical cancer. During a pap smear, a swab is used to take samples from the cervix. First trimester screening can diagnose most cases of Down syndrome. If your risk level for genetic disorders is low, testing done in the first trimester can indicate that the pregnancy is normal and can ease your mind. If you have a higher risk of genetic disorders, additional testing can identify problems you may face. If you are older than 35 and have a family history of genetic disorders, your healthcare provider may recommend chorionic villus sampling, or CVS. CVS is used to find genetic problems like Down syndrome. A small sample of placenta is taken for testing. CVS has risks including miscarriage, birth defects, or infection. Genetic testing is usually done before you start trying to get pregnant, but it can be done in early pregnancy. Your healthcare provider may recommend genetic testing if you or your partner have a family history of genetic disorders. Genetic testing can be used to diagnose certain genetic disorders before birth. These include cystic fibrosis, Duchenne muscular dystrophy, hemophilia, thalassemia, sickle cell anemia, polycystic kidney disease, Tay-Sachs disease. Second trimester prenatal testing. Prenatal testing in the second trimester can track your baby's growth. Lab tests look for problems in the mother and baby. Blood tests may be done to screen for certain conditions. Glucose screening is done at 24 to 29 weeks to check for gestational diabetes. Gestational diabetes is a type of diabetes that happens in some women during pregnancy. Glucose screening is a blood test that measures your body's response to sugar. Most women with gestational diabetes give birth to healthy babies, but it can lead to various complications if it is not managed. A special blood test called a quad test can be used to diagnose Down syndrome and neural tube defects. An ultrasound during the second trimester can be used to look for signs of problems with the baby's organs and body systems. It can also confirm the age of the fetus and proper growth. It also might be able to tell the sex of your baby. Your healthcare provider might recommend amniocentesis. It can be used to diagnose genetic conditions, neural tube defects, and infection, as well as to determine whether the baby's lungs are mature enough for birth. This test has risks. Talk with your healthcare provider about whether amniocentesis is right for you. Third trimester prenatal testing. The third trimester of your pregnancy also involves prenatal testing. Your healthcare provider may swab your lower vaginal and anal areas for GBS, Group B streptococcus. GBS is a common type of bacteria that is usually harmless in adults, but babies who become infected with GBS can become very ill. Antibiotics given during delivery can help protect your baby. Your doctor may swab your cervical area to test for substances that may help predict your risk for preterm labor. A biophysical profile, or BPP, is also done during the third trimester of pregnancy. A belt is placed around the mother's belly to measure the baby's heart rate in response to its own movements. It measures the baby's breathing, movement, muscle tone, and heart rate. A contraction stress test may be done. During a contraction stress test, the baby's heart rate is monitored while mild contractions are brought on. They may be started by medications or by squeezing the mother's nipples. This test may start labor.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Whether you are pregnant or are planning to get pregnant, you want to give your baby a healthy start. To do this, you will need to have regular visits with your healthcare provider throughout your pregnancy. Prenatal testing provides information about your baby's health before he or she is born. During pregnancy, some routine tests are done to check on your health as well. Prenatal tests can be used to identify the mother's health problems that might affect the baby's age, sex, size, or position in the womb, the chance of some genetic problems in the baby, certain types of fetal abnormalities, including some heart problems. First trimester screening can provide valuable information about your baby's health. Your healthcare provider might offer an ultrasound, blood tests, urine tests, other screening tests. Prenatal testing in the second trimester can track your baby's growth. Lab tests look for problems in the mother and baby. Blood tests may be done to screen for certain conditions. The third trimester of your pregnancy also involves prenatal testing. As an expectant parent, it is important to educate yourself about prenatal tests. You should think about what you will do if a health problem is found in either you or your baby. Thank you for using Explain.